The Deputy Minister of the Department of Social Development, Hendrietta Bogopane-Zulu, in collaboration with the South African National AIDS Council, SANAC, and the United Nations Fund for Population Activities, UNAIDS, and sex worker advocacy groups held a dialogue with sex workers. This was to review progress on the implementation of the sex worker strategy of 2016 to 2019 and also to discuss the 2019 to 2022 proposed plan. It seeks to explore the challenges that sex workers experience amidst the COVID-19 pandemic. Let us now talk to the Deputy Minister of the Department of Social Development, Hendrietta Bogopane-Zulu, who joins me now live via Zoom. A very good afternoon to you, DM. Always good to talk to you here on the SABC News channel.
Hey, Palisa. Good afternoon to your viewers.
All right, so let's just start with this sex worker strategy of 2016 to 2019. What has the progress been on that front?
Firstly, we need to say we've not done very well because we had an independent consultants evaluate our implementation of the 2016-2019 sex worker strategy. A lot of the departments, including our own, have not done very well. I think the department that did a little better than all of us is the Department of Health. So it was quite a shocking feedback for us as government in terms of the commitments we made in the 2016-2019 sex worker strategy.
But why? Why has not much been done, Deputy Minister? And also, what are you hoping to achieve with the 2019 and 2021 proposed plan in this regard?
There's two things, Palisa. The first one, I think, when we launched the sex worker strategy with the Deputy President, now the President, Cyril Ramaphosa, there was too much. It was the first country strategy, but also the first in the world. So I think we were all struggling to try and say, how do you actually elevate services to sex workers while they are actually illegal? So I think we all went into the struggle, whereas it was easy for health, because all that they also did was to provide healthcare services. And when you seek healthcare services, you actually don't declare whether you are a sex worker or what. When you come in, you get assisted. And that is the only area where we did well. I think all of us went into struggling to put together the package. What we did well as DSD was to develop the register where we've captured up to 65,000 sex workers so that we are able to know where they are and we are able to provide psychosocial support and all of that, but also fund the NPO for advocacy work that deals with sex workers. That is what you can accredit as. And the lead department in the second aspect is that all of us were supposed to lead bits and pieces of the implementation. And I think it just got lost in translation, to be very honest. I can't really say to South Africa why, but I think we did 2 of the 5 targets as DSD. I can't answer for the rest of the departments, but I can only say that some of the targets were dependent. We depend into each other. For example, on the issues of human rights, unless justice actually issues the guidelines, social development cannot move in that area. So there was that interdependability that also, I think, made all of us to kind of like go into a slow motion. What is different, as you said, your second question, to the 2019-2022 sex worker strategy that we were consulting and that we are about to launch? The difference is that the sex workers are now allocated to social development as the lead department by the Deputy President of the Republic. So we now know who is the lead department to coordinate everybody else. So that particular aspect has been taken care of. But we've also now established the sex worker national organization so that they've affiliated in their different localities. That's the second thing that will assist us to do better. But the third thing is that we are halfway into the decriminalization of sex work. So that is also going to give us a push of ensuring that we are able and ready to lead as the coordinating department, the different departments.
All right. DM, I'm afraid we've got to go somewhere now. We need to leave this at this, but we thank you so much for coming through. This, of course, is a conversation for a different day. We'll have you back here on the show. Thank you. All right. So the